Why there is the need of writing HCL with the name or sodium with the name? Very simple question and very simple answer. The answer is that most of the drugs, they contain the active pharmaceutical ingredient, and those ingredients are in weak acidic or basic form. So we know this point. If substance is weak acid or weak base, that is not going to be dissolved in the solvent in an easy way. So what we are supposed to do is that we will do some extra efforts in order to accomplish the job. Means in order to dissolve that particular weak acid or weak salt base in the solvent. Guess what? We have weak acid and we want to dissolve that in the water. So it will take time and extra efforts to do that. Instead of this weak acid, if we convert this weak acid into a salt form and dissolve it in the water, it will be dissolved very easily then. The same goes with the medicine. Medicine that are in weak acidic form or in weak basic form, we convert them into the salt form. Then it becomes easy for them to be dissolved in the body, in our GIT tract. When it is dissolved, then it will be easily absorbed in the body, and at the end it will do its job, whatever the drug you take. Guess what? Now here I have mentioned a drug that is having the HCL in the name. Now this means that this particular drug is having the active pharmaceutical ingredient, the API, the real drug that is supposed to work, that is in weak base form. So we then added the HCl with that. Now HCl is a strong acid and a base. They will form salt. Now that salt, when it goes inside the body, will be easily dissolved. And if it is easily dissolved, it will then be absorbed easily, and as it is absorbed easily, then it will be distributed easily, and at the end it will do its job, whatever the medicine was supposed to do. So in short, salt formation is actually increasing the pharmacokinetics of the medicine. The last point is actually for those who are dealing with medicine in professional way, either they are MBBS students or pharmacy students or pharmacy doctors or MBBS doctors. Well, that was for them. Anyways, that's all. Thank you for watching Dr. UUT lectures.